From the nation's capital, Eye on Washington with Marilee Joyce. A weekly discussion about the federal issues most important to Nevada. And now, from Washington, D.C., here's Marilee Joyce.
And good day to you. I'm Marilee Joyce, and this is Eye on Washington, the only statewide Nevada news program produced in Washington, D.C. Every week, Eye on Washington takes you straight to Capitol Hill for a discussion with Nevada's delegation and other leaders about the federal matters that matter to you. Today's topic, stopping a sad, irreversible decision, an update on suicide in Nevada and One Nevada Hospital's efforts to help the hurting. And my very special guest today is Dr. Tony Slonim, the president and CEO of Renown Health. And thanks for being here again today.
Thank you, Marilee.
One person every 13 hours. That's the rate of suicide in Nevada, where 3 times as many Nevadans die by suicide each year as by homicide. And today on Eye on Washington, we'll tell you about a new report saying suicide is holding steady in Nevada, but remains a serious problem. We'll update you on what Renown Health is doing to help those struggling with a variety of mental health challenges. And later in the show, we're going to tell you about a brand new Renown Health Institute to battle a top Nevada problem. Last June, the Centers for Disease Control released its updated suicide statistics, which showed Nevada is the one state in the union where suicide is down. But while any decrease is great news, it is down by just a single %. Nevada still ranks 7th in the nation. About 21 of every 100,000 Nevadans commit suicide annually, compared with an average of 13 people per 100,000 nationally. Suicide is the 3rd leading cause of death for Nevadans 15 to 24 years old. It's the 2nd leading cause of death for those aged 25 to 34. And while the CDC says it's the 12th leading cause for Nevada seniors, that demographic is way up. According to the United Health Foundation's just released Senior Report 2018, approximately 32 of every 100,000 Nevadans aged 65 and older commit suicide. That is double the national rate. And Dr. Slonim, thank you for talking to us about such a sad subject. And of course, we are going to let you share some hope you have about all this later in the show. But for now, I want to talk about the problem, and I want to start about this recent reported uptick in senior suicides. I saw that United Health says that much of the blame for this growing rate is the growing isolation among our seniors, and that really leads to a lot of other depression and other mental health problems, doesn't it?
Yeah, Marilee, I think that you point out some important things. We've got high rates of suicide across a number of age groups, and each one of them has their own independent risk factor. For seniors, isolation is among the top. As people grow older and their friends start to die, as they become more lonely, as they get isolated in their homes without a network of people perhaps that they feel care about them, they pull into themselves and lose hope. And when you lose hope, that's a terrible place to be.
I mentioned that the CDC report does say that Nevada is the one state in the whole country that has a decrease in suicide. And 1% is not a lot, but it's something. It's not an increase, but we're still 7th in the nation. And I know that your behavioral health services unit focuses on this and some other health mental problems. So I wondered if you share your thoughts on some top reasons why Nevada's suicide rate is so high. What are you finding among those who study it at your center?
Yeah, I think that there are a couple of things. First, you want to make sure that people have you identify the risk factors for people in those groups. Isolation seniors, one. Adolescents have another high-risk group, and we have to try and figure out what's driving their need to commit suicide. I think the second thing is having an adequate mental health infrastructure so that people who are identified are able to access the kinds of services they need to prevent suicide from happening, whether it's in a crisis mode or on a longer-term, more chronic basis. And the third thing, which is really where our efforts in the new institute are focused, is around screening. How do we do broad-based screening to identify those most at risk and thereby help to get them into treatment when they may not even know they're vulnerable?
You know, we're going to talk about Renown's work through your unique behavioral health services unit later in the show. But I'd like to let you address what you stress on your site and what you've shared with me on some other shows about some other issues, the huge importance that you and Renown place on tailoring what other health challenge you guys are trying to meet, in this case mental health, but tailoring mental health help to suit each person's precise needs. You always emphasize that it's not cookie cutter. It's not a one-size-all-fits-all cookie cutter way of helping someone who's struggling, is there?
You know, people are individuals and they have different parts of them that drive towards one action or another. It's our responsibility to meet them where they are. And for that ability to be independent, you know, there's certainly national norms, there's guidelines, there's pathways, and there's evidence-based medicine we need to follow. But nothing helps more than making sure you're giving that personal touch, holding a hand, lending a smile, and being there for people when they need someone to care about them.
And they can feel it too, can't they?
Sure.
When we return, Help for the Hurting, Renown's big effort to treat those with mental health disorders. We're going to tell you all about it right after this.
You're watching Eye on Washington with Marilee Joyce, brought to you by Caesars Entertainment, the Regional Transportation Commission of Washoe County, the Las Vegas Sands Corporation, the Las Vegas Convention and Visitors Authority, NV Energy, Jim Marsh Automotive and Body Shop, the Rogich Communications Group, and Renown Health.
I have 3 tests next week. I'm going to be studying all weekend. Ugh. Are you studying tonight? We can meet up and study together. Oh yeah, that sounds good. What time? I work until 6. Okay, sounds good. Just text me after. Okay. No!
There is no text, tweet, or call that's worth a life.
One pedestrian death is one too many.
Look up.
And look out for each other.
Want more federal news that affects Nevada, its businesses, and its residents? Then you need to subscribe to Nevada's Washington Watch newsletter, your sole source of online news direct from Washington, D.C. Visit joycecommunications.com and subscribe today.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
I got my own iPod Touch and used my dad's login to get on gambling sites. Poker is the best, but I'm losing a lot. Since I'm too young to play, they're not allowed to keep the money and my dad won't find out. That's right, isn't it?
Unsafe sleep conditions cause serious injury and even death to infants. Never sleep with your baby on a sofa, in a chair, or in an adult bed. Protect the baby you love from becoming a tragic statistic. The only safe place for your baby to sleep is alone, on its back, in a crib, and in your room. For more information, visit cribsforkids.org. That's cribsforkids.org.
And welcome back to Eye on Washington, our discussion of Nevada's high ranking for suicide, mental health problems, and addiction. My special guest today is Dr. Tony Slonim, the president and CEO of Renown Health. Well, to impact suicide, you've got to treat depression. And to do that, you need something Nevada doesn't have enough of, and that's mental health treatment resources. According to mentalhealthamerica.com, Nevada ranks dead last, that's 51st, for access to mental health treatment. The ranking is based on 3 factors: number of adult residents with mental illness who are not getting help, shortage of mental health care providers, and number of uninsured adults. When Dr. Slonim joined us a year ago, he explained how Renown is trying to change Nevada's reputation as a state greatly lacking in treatment programs, and that's through the Renown Behavioral Health Services, which seeks to fill that vacuum, offering specialized treatment for 11 areas, including depression, anger management, obsession compulsion, grief, schizophrenia, sexual abuse, and much more. And Dr. Slonim, when you couple a high suicide rate with the dearth of mental health treatment resources, you really have a bad and worsening situation. And is learning about the need, was that sort of one of the impetus behind your starting the Behavioral Health Services Unit?
You know, I think that no one would argue with the fact that mental health is a public health crisis in Nevada, and we have to come together in order to solve this problem. Renown alone can't do anything, but it can't do it by ourselves, but the Behavioral Health and Addiction Institute is an opportunity for us to come together with a wide range of community-based resources and other people who know how to make a difference. Right. We're just working in different directions, and we need to pull this together in an aggregated way where we can really make an impact.
You know, I saw statistics from the Substance Abuse and Mental Health Services Administration that said 5% of Nevada adults, 9% of Nevada youth had some sort of a serious mental illness problem within a year of being surveyed. That's very high. You have 2 behavioral health locations. How busy are they at any given time? What successes have you been seeing so far? What can you tell us?
So the behavioral health locations are busy. There are people who want help, but the problem is that we have to get ahead of that. In the conversation of suicidality, one of the challenges is people may not even know that they're at risk. They may not even know until they're feeling down or depressed or without hope that they may not even contemplate suicide up until that very moment. So how are we moving that upstream? Screening, prevention. Excellent. How are we making sure that the people who are most at risk, those kids, those seniors that we talked about, are getting the kinds of screening access that we get so we can get them into treatment programs?
A big problem Mental Health America cited regarding Nevada's lack of treatment resources is a shortage of mental health care providers. How focused are you on attracting the top specialists in Northern Nevada to work in your centers? Absolutely.
This is a major crisis. We have a shortage of doctors per capita, generally speaking, and along major specialties. We also, to that statistic you quoted, have a shortage of psychiatrists. The nation has a shortage of psychiatrists. So while we continue to recruit, it's difficult to recruit people to areas where there's a high potential and a high crisis problem. It seems kind of counterintuitive. But any psychiatrist comes to Northern Nevada knows they're going to work hard. And that because we have so many people who need the service, we have to continue to bring more providers in.
We talked about the importance of focusing on the unique struggle of each patient. When you were on my show last year, you stressed what you call the people component of healthcare in general at Renown, but isn't that philosophy even more important when you're dealing with those struggling with mental health challenges?
Absolutely. There is a terrible stigma associated with mental illness. People, even clinical people, don't treat it the same way they treat a problem with your heart, a stroke, problems with your lungs. They think in some way the person who's afflicted with mental illness has some will that they want to be sick or just isn't trying hard enough. And we have to break that stigma, which allows people to get better access to care in a way that's caring and comforting when they're most at risk. And I think this issue of caring for people and not patients is no better executed than in the world of mental illness.
And are you seeing that strongly focused on in your behavioral health area?
You know, we have brought an approach of what we call We Care, a We Care program to the bedside. We approach all of our patients with that We Care philosophy, but it's particularly important as we go about welcoming those with mental illness into our therapeutic arrangements.
And when we return, another service desperately needed by so many Nevadans, Renown's new offering focused on one of Nevada's top crises. We're going to have details on that right after this.
Nevada's direct link to Capitol Hill. Eye on Washington with Marilee Joyce. The only statewide Nevada news show based in Washington, D.C. All the top federal matters that matter most to Nevadans. Merrilee talks with our congressional delegation and other leaders about the federal news you need to know. Eye on Washington with Merrilee Joyce, Nevada's Eye on Capitol Hill.
When you think RTC, what comes to mind? How about jobs? RTC road projects bring thousands of jobs to Washoe County, expanding and connecting northern Nevada, growing our local economy, providing a more secure future for our residents and their families. So when you think jobs, think RTC. Your RTC, the RTC of Washoe County.
My dad's addiction and death from overdosing on opioids has taught me everybody knows somebody who is struggling with this very problem. Losing my mentor, my best friend, somebody who made me the person that I am. He took one pill too many that ultimately killed him.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
You've served our country and made us proud. Many of you have come home, continue to lead, and look out for one another. So it's important we all learn the 5 signs of emotional suffering. If you or someone you know is experiencing one or more of these signs, reach out, connect, offer to help.
Hey, what's the matter?
In or out of uniform, we can help our families and nation stay strong. Visit changedirection.org.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
And welcome back to Eye on Washington. Our discussion of my guest's work to provide needed treatment for Nevadans struggling with mental health challenges. And we've been visiting with him today. He is Dr. Tony Slonim, the president and CEO of Renown Health. Well, let's look now at another huge behavioral health challenge facing Nevada and some good news from my guest regarding efforts to combat it. According to the National Institute on Drug Abuse, more than 90 Americans a day die from opioid overdose. And Nevada is among the states with the heaviest rates of opioid prescriptions. Well, last May, my guest was thrilled to announce the establishment of the Stacy Mathewson Behavioral Health and Addiction Institute at Renown. Thanks to a $6 million donation to Renown Health Foundation, the newly established institute will focus on expanding community access to prevention and intervention services for mental health disorders and alcohol and drug addiction. Over the next 5 years, the institute will expand intensive outpatient treatment, partial hospitalization programs, and medication-assisted treatment. And Dr. Slonim, congratulations on this new center. It sounds like a big focus there is going to be helping Nevadans addicted to opioids. I mean, it has many specialties, but I really want to zero in on its work on opioids because this is such a frightening and huge problem in the state, isn't it?
It is horrendous. And without the generous support of the Mathesons, we would never have been able to kick off this institute. So really an investment in our community that will hopefully address the issues that many, many families face around addiction.
I was interested to see that the Institute has an independent crisis facility, since time truly is of the essence in treating opioid abuse treatment, isn't it?
It sure is. And we're trying to make sure that we're complementing the existing services in the community, not necessarily adding a whole bunch of new things, but adding things in a way that they're complementary to other activities that are already in existence. For example, we know that quite a few babies are addicted to opiates and are addicted over in the medical center, which is a renowned facility. And so we want to make sure that we have a neonatal abstinence program that goes into place and is cutting edge and evidence-based. We know, and this has been a priority area for Stacey Matheson, is the screening of kids who are at risk because of a family member's addiction. How do we address the issues and screen before that child gets addicted? Because we know addiction runs in families.
So what led to this? Tell our audience more about the Mathesons, about the big donation. I think you said they had a child, right? That was
Stacey Matheson has had a concern about addiction in her family and is very public about that and wanted to do something to address this crisis for other families, and is really focused on the familial component of addiction and making sure that, and that's why we're focused on kids and we're focused on the educational system and we're focused on screening, because hopefully we can get ahead of the curve and stomp out this terrible condition.
You know, as you know, of course, we always try to look at the federal side of issues on my program. So let me ask you this. What, in your opinion, is the top thing that our congressional leaders can do or should be doing to get needed help to those dealing with mental health issues and addictions?
Yeah, I think there's a couple of things. I think first, right, we have to make sure that the people who are addicted are getting appropriately cared for and getting their addiction addressed. Second, we have to address new and better ways to manage people's pain, because pain in opiate addiction is the primary reason. We don't want to go down the wrong track here. If you stop opiates, you have to provide other mechanism of controlling people's pain. And I think the third thing that we need is better research to guide the way that we address this important issue.
So how can this be addressed on Capitol Hill?
I think funding, certainly in the research arena. I think that the NIAID has some amazing research programs going on, making sure that we continue to drive federal funding for research at the highest level is very important in this condition, as well as treatment facilities on the ground so that that evidence that's created from research gets implemented in the local environment.
All right. And when we return, another way Renown Health wants to better serve patients and improve health care. Right after this.
Planet Hollywood, Paris, Harrah's, Caesar's Palace. It's one of the most exciting skylines in the world, Las Vegas. Caesars Entertainment has nearly 50 casinos worldwide, including these. But no matter which casino you visit, we want you to play responsibly. And if you need help setting or keeping a limit, we hope you'll call this number. You see, we know you're coming to our casinos to have a good time, and we always want you to leave feeling like you did.
Nevada's direct link to Capitol Hill. Eye on Washington with Marilee Joyce. The only statewide Nevada news show based in Washington, D.C. All the top federal matters that matter most to Nevadans. Marilee talks with our congressional delegation and other leaders about the federal news you need to know. Eye on Washington with Marilee Joyce. Nevada's Eye on Capitol Hill.
I got my own iPod Touch and use my dad's login to get on gambling sites. Poker is the best, but I'm losing a lot. Since I'm too young to play, they're not allowed to keep the money and my dad won't find out. That's right, isn't it?
Are you studying tonight? We can meet up and study together. Just text me after. Okay. No!
There is no text, tweet, or call that's worth a life.
One pedestrian death is one too many.
Look up. And look out for each other.
My son Steve did not want to die. He wanted to get well. He tried really hard to get well, but his prescription opioids killed him. We found a Post-it note that he had written about his opioids. At first, it was a lifeline. Now it is a noose around my neck. You never expect that you're going to lose a child. It's all out of order.
Want more federal news that affects Nevada, its businesses, and its residents? Then you need to subscribe to Nevada's Washington Watch newsletter, your sole source of online news direct from Washington, D.C. Visit joycecommunications.com and subscribe today.
And we are back with our closing segment of today's Eye on Washington, and we've had as our very special guest Dr. Tony Slonim, the President and CEO of Renown Health. Dr. Slonim, I thought we'd switch gears a bit as we close out today's program and talk about something else that I know is a top focus of yours, and that is healthcare transparency. You've been talking a lot about it in public and online, and I read your statement about it. You said that we carefully research decisions like those regarding big purchases and buying a house and a car and where to invest our money. But when making the quote, as you call it, the most important decision of all, those affecting our health, unquote, you say that historically it's difficult for people to easily find information on cost, on quality, the types of information we would find when making those other purchases or investing our money. And you've really been working to change that, and it is a top focus of yours right now. What's Renown Health doing regarding this?
So we're very excited. You know, this came out of a personal story for me. So 17 years ago, I had cancer. And you know how I found my doctor? In the Yellow Pages. And understanding how someone who's a physician and educated in policy had to go to the Yellow Pages to figure out who they were going to see was really disturbing for me. And so as I moved along in my administrative career, the focus on quality and the need to make sure we were sharing those quality data, whether they're clinical quality estimates or estimates of how doctors care for you from a service perspective, was really important to make known so that people who seek us out for care could get the information they need to make an informed decision.
So give me some example of what Renown's been doing here.
We've been working heavily with posting our physician satisfaction scores. So in aggregate, when patients come in, we ask them to fill out a survey about their provider, and then we post those comments by providers so that people who are trying to choose a new doctor can understand the way in which that doctor, how their bedside manner looks, and in what ways they relate to their patients.
Excellent. Okay, doctor, thanks so much for sharing that, and thanks for being here today.
Thank you.
And that does wrap up this week's Eye on Washington. For more on any federal issue that impacts you in Nevada, you can just visit our website, joycecommunications.com. Be sure to like us on Facebook and follow me on Twitter and catch up with any shows you may have missed on our YouTube page. Thanks so much for joining us on Eye on Washington. I'm Marilee Joyce in Washington, D.C. Have a great day.
Thank you for watching Eye on Washington with Marilee Joyce. Eye on Washington with Marilee Joyce airs statewide in Nevada solely due to the generosity of our sponsors. Can your company help us continue our mission to remain Nevada's top source of federal news? If you can help us help Nevadans, please visit joycecommunications.com/WordPress/EOW sponsors and join us today. That's joycecommunications.com/WordPress/EOW sponsors.